ADHD medications can be a good option for helping people with ADHD, but what you probably don't know is there's some ugly truths when it comes to ADHD medications, so I'm going to dive in that right now. Hi, I'm Dr. LeGrand, and I have ADHD and dyslexia, and certainly just like anybody else with ADHD, have had either the good or bad experiences with ADHD, myself included. When I first was taking ADHD, I definitely had a lot of different side effects that I did not like, and so I found different options. So I really want to talk about 5 different ugly truths that you probably do not know about ADHD medications that were never actually conveyed to you through your doctor, that you really should be considering whether you are wondering if you should be taking it or not be taking it because there's certain things that you're worried about. So the very first thing that we need to understand about ADHD medication is how does it actually impact our brain? How does it actually impact your body? What is the mechanism going on? So if you're not very familiar with ADHD medication, especially most ADHD medications, there is the stimulant kind and there's the non-stimulant. So the stimulant medications are typically going to be targeting helping improve dopamine and norepinephrine because that is the common thing that has been known with ADHD to be usually deficient. The problem with this is these types of medications, what they're doing is they're targeting improving these levels, but how they're doing it is through mostly an SSRI, which the RI stands for inhibiting reuptake. So what that means is if you think about the 2 different types of synapse neurons coming together and actually transferring those different types of neurotransmitters, such as dopamine and norepinephrine, which tend to be low with ADHD, what it's doing is it's blocking the reuptake of the communication between those synapses. What that reuptake does is it's communicating back to the brain that, hey, we have enough dopamine, we don't need to produce it anymore, we could slow down. But what the ADHD medication doing is it's blocking that so that it can increase more dopamine and norepinephrine. Now you might be asking, why is that a problem? Well, the problem is that what we've seen in research is they have seen by taking ADHD medication over time is that your body will naturally stop producing dopamine and norepinephrine at a 20% decrease that they've seen over time. So by just 20%, that's pretty significant. And this is why people who go off of their ADHD medications have a very hard time actually going off of them because they have a lot of withdrawal effects, especially if your body's been taking the medication for a long period of time. Then guess what? Then you are not producing it naturally because you have been doing and inhibiting that reuptake over several years, depending how long you've been taking it. So it's something that definitely people do not teach you about because it is definitely a side effect, and they've seen research where it has reduced the body from naturally producing it at a full capacity. The second ugly truth about ADHD medications is that there is a lot of harmful side effects that come with ADHD medications. From my experience when I was taking Adderall is that I felt like a zombie. I was completely not myself, like I could focus, but I felt more depressed. I felt like a zombie. I didn't feel like myself at all, and I didn't really like it. And this is why I stopped to taking medications and found different avenues to help with my ADHD. But some of the common side effects that I do see people who do take ADHD medications is not just feeling like a zombie, but also feeling more anxious and stressed, agitated, also dealing with issues with sleep, and also your appetite issues can also impact people's weight. And on top of that, it can impact the heart, especially increasing heart palpitations, especially if you have a heart condition. This is why a lot of people who have heart conditions usually can't take a stimulant medication because it is too risky to be taking. The third ugly truth that I find with ADHD medications is doctors will simply just give you a medication without doing any lab testing or any kind of testing. It's just a questionnaire and that's it. And then you're used as a lab rat. It's like, here, try this. Oh, that didn't work. Try this then. Oh, that didn't work. Okay, let's increase the dosage or decrease the dosage. So you feel like a lab rat, and your brain chemistry is going to be changing quite a bit, especially when you're switching through different types of medications. And that in itself comes up with a lot of side effects and can mess a lot with your brain chemistry when you are doing no kind of testing first. And this is where I find it so critical before you start doing any kind of medication or any kind of treatment is you should get some testing done, because there's ways to test for neurotransmitters. There's ways to test for different nutrient deficiencies that are very common with ADHD, but you should be doing that first before you really do something like taking something like a stimulant that could be more damaging than good, because you have no idea if you have low levels or high levels of dopamine. And if you're taking a medication that actually increases it and you already had increased levels of dopamine to begin with, guess what? You're going to feel agitated and irritated, and that's going to be causing you more damage than good. So if you really want to know which types of testing you should be doing for your ADHD and overall health, then you should download my free guide in the description below. It's my ADHD guide that goes over all the testing you should be doing, all the nutrients that you should be implementing as far as different supplementation and alternative ways of addressing ADHD to impact your ADHD health. So like I said, it's in the description below. So the fourth ugly truth about ADHD medication is it does impact your health in a very harmful harmful way. And these are the things that I have seen across the board when I am working with people with ADHD. One is it definitely impacts people's sleep. When you're not have good sleep, guess what? That's going to impact your energy. That's going to impact your heart health. It's going to impact your immunity. So it's not just your ADHD health, but also other aspects of your health that it can impact you if your ADHD medications are causing sleep issues. Other things that I have also mentioned before is that it does impact your overall stress health. So most people with ADHD, in fact, 50% or more people with ADHD tend to have anxiety issues. So ADHD medications can have that next layer, especially if you're not on the right type of medication or the right dose, and that can impact your health even further. On top of that, it can impact your heart health, especially if you do have a tendency to have heart palpitations or other heart conditions, and that is where it can be risky by taking something like this. And then the other thing that I would say is it can impact your personality. Like for myself, I did not feel like I was myself at all when I was taking the medication. And I didn't like that about me. And I felt like I did not have that control over my life because of it taking over of who I really was. And people thought I completely changed when I was on the medication. Which leads into my fifth issue with ADHD medications, like the ugly truth that I find is that you do not have complete control over your life. Because what happens is when you're on ADHD medication, it can be a very powerful tool, especially if you have very high severe ADHD symptoms, and that is your only option. I'm not here to say ADHD medications are completely bad, but I'm here to educate you that there is some things you need to consider before actually taking an ADHD medication, or if you're taking it already, because really what happens is when you stop taking that medication or it runs out, right? Guess what? Those symptoms start coming back and you feel like you do not have a complete control of your life because your mood and also your energy, your focus is up and down, because it's reliant on the medication. And when that weans off, then you got to take your next dose. Versus when you are actually implementing more nutrition, exercise, different things, lifestyle changes to take charge of your own health and your ADHD health. That is what I do, and that is what I've done for a lot of my patients and clients, is it gives you more power to your health versus with an ADHD medication, you're completely reliant on it. And if you were to take that away, guess what? All the symptoms come back. And in a lot of cases become worse because of what we talked at the very beginning of how much you are decreasing, you naturally producing dopamine and norepinephrine levels throughout your body. It is very important to really educate yourself when it comes to your own ADHD health, especially if you are in the early stages of finding out if you have ADHD and considering taking ADHD medications or not. You really need to consider these things. And I'm not here to say that, you should never take ADHD medications. I think it is important to use that and support tools, or maybe you don't need to use the ADHD medications because of all the things that I did mention. But really what is important is understanding where are the deficiencies throughout your body and looking at lab testing that could find and identify of why you do have these ADHD symptoms and what are the root cause of the problem versus just doing a questionnaire. So you should watch this video right here of the common lab tests that doctors just do not run, but are critical for you to identify the diagnosis of your ADHD and really what is the root cause of the problem so you know how to treat it.